My name is Maria Pyle. I am actually a principal at Highlands Community Charter School, and I have been working there for just a couple of months. Prior to that, I served on a pastoral staff at Liberty Towers Church. There was an event a vaccine clinic event at North Highlands Antelope Library. At the event, at the vaccine event, we were hosting a table where we were just giving out information about the events that we have and activities we have at our church, but also the testing. We do COVID testing every Monday at the church, free COVID testing for the community. And so we had a table at that event, and at that event, you were giving free blood sugar tests and blood pressure tests for the community members who came through. So that's how you and I met. What I know about community needs and how it relates to the healthcare crisis, I know that there are a number of community members, especially in the North Highlands Foothill Farms area, who are underserved in terms of the healthcare that they've received. Very low service that they've received. Unfortunately, a number of them don't go to get their needs met in terms of healthcare because the services are not easily available for them. I do know certain members who have to travel to get seen by a doctor. Personally, what my mom has experienced, poor care, poor service, poor attention, and that's affected her personally, which I wonder if it has intensified her memory loss that she always struggles with, and she feels bad when she forgets, but I think it's linked to the poor service that she's received in terms of healthcare. She was very discouraged. She was at a time where she needed certain medication, and she had a new doctor, and the doctor was so impersonal, very impersonal. She went in, and I would say it wasn't anything more than 2 to 3 minutes with this doctor. She came to an event that we were having at the church, and she met you. And it's in meeting you that she felt, oh my goodness, there's hope. I can get some care or attention that I need. And she got that from you. Not the doctor per se, but in receiving that personal care, you listened to her. You gave her hope and suggestions of what she could do. You provided support in terms of calling a doctor, and that just made her feel like there's hope. And so I know that my mom is feeling very encouraged by ELAK Health. I do want to add, there was an event where we had Hispanic Heritage Month, and we had a celebration there, and every individual who went through all the vendors there, who went to your table had the longest line. People were listening to others saying, oh, she helped me out. I had no idea about my blood pressure. I really want to focus on where I stand in terms of diabetes and to take the proper care. They were hopeful, they were renewed to really look at where they stood health-wise and wanting to make a change. So in that event, hearing community members come back to our main table and speak highly of you, and for them to actually care and want to make a change or start being active in terms of their own lives, you represented and you showed a gap in individuals who I really do think it reflected. We want to take care of ourselves, but it's not until we know we're in safe care that we're going to actually do something. So I witnessed that there. And the diabetes that education you provided at another event, again, community members came and said they were so thankful that you provided that we had that workshop, and that's all because you came out. In the other event, and that was during a harvest event that we had. Instead of trick or treat, we actually had a harvest event. again, community members felt so supported by you. And I'm going to go back, I'm going to use that word hopeful, because I believe that's what ELAK Health provides, a sense of hope that there's someone who is listening and they care about me, and I actually can take steps to be healthy. There is a church member who said to me, this was after church on Sunday, Maria, I just wanted to let you know that I was so afraid about my blood pressure. I know diabetes runs in my family, but in talking to Dr. Sarah, I feel like I can manage it. That's what she said after church. And yes, no, I felt so good about that. Like, yes, that's what it's about. For our church, it's about community outreach. And I believe part of community outreach is definitely connecting to the players, such as you, with the community. So any event we have, you guys definitely should be there. My advice is to do what you've done, to reach out and say, I'm available. How can I participate? How can I be available? Going to the community-based organizations or faith-based organizations and let yourself be known of what you're able to give the community, education, information, presence. Your presence alone is quite significant. And again, I believe the presence in the welcoming, non-threatening, non-judgmental manner disarms community members and allows them to face, I'm not going to lie, it's a fear to face, I have diabetes and what that really means. Well, if you see the hope with information, then you can face it and take it on. So again, just being available, extend yourself and let others know that you're available to be there.